Hi. Can I get a name? And birthday. Okay. You're here for a checkup? Okay. I have some questions on here. I'm just gonna need you to sign. Yep, just sign here and here. Okay. And you can fill out the rest of the questions. Okay. And you can wait over there. Yeah, no problem. Looks like they're ready for you, actually. Room 10 over here. Hello. Welcome in. Welcome in. Hi, yes. Okay, I've been looking forward to this exam. How are you? Good. Okay, good. Okay, so today it looks like you're here for the annual routinely checkup. Yes, okay, that's what I thought. Is there any issues that have occurred in the last year since I last saw you? No? Okay, perfect. Anything that I should know about at all? No? There's no issues or anything since the last time I saw you, correct? Everything seems to be working okay. Okay, perfect. So today I just wanted to test out a few things just to make sure that your brain is working perfectly. Okay, is that okay with you? Okay, perfect. I'm so excited. Let's get started. Okay, first of all, I just want to get your vitals. So we can start with me checking on your heartbeat. Okay. So, okay. Okay. smell. Okay. Okay. What do you smell? Vanilla? Perfect. Okay. Let me get another one. Okay. And what does that smell? Rose. Perfect. Okay. Let me just jot that down real quick. Alrighty. Okay. And now I'm just going to test out your eyes and see how your pupil changes with this flashlight. Okay. Ready? Whoa. Okay, ready? Look here. It's a pretty bright flashlight. Look here. Just follow it. Okay, yeah. Your pupils immediately dilated, which is a good sign. Perfect. Right. And next, I'm going to be doing some measuring. So, this is my mini measuring, and I'll use this for measuring, just getting like all your ratios. Okay, so that's just the small one, so let's start with your neck. Okay, very good. And let's do your arm. You must work out, huh? That's what I thought. Okay, perfect. And let me go get my big measuring tape. Alright. I got my big measuring tape here. Okay. Let's start with your waist. Is that okay with you? Okay. Okay, just measure here. Okay. Okay. Do here. Oh. Let's just do here. Perfect. And around. Okay. Now let's measure your leg, okay? And your leg height. Okay. 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 And all of them seem to be perfect ratios. Oh, what's it for? We just like to get the ratios just for the record. Just in case anything changes drastically, anything like that. Okay. So far, you've been doing great. One of the best I've seen. Okay. And now here, I have this little thermometer just to get your temperature, okay? Okay. Usually just takes a couple seconds. Perfect. Okay. It says that you're really hot. Let me write that down. This could be a problem. Let me just redo that for you, just in case if there's any error. Okay. Okay, actually, it says 98.6, which is in the normal range. Must have been a mistake. Sorry to scare you like that. Okay. So your temperature seems to be perfectly fine. Okay, now I'm just going to ask you some questions if you don't mind answering. Okay, perfect. Okay, so first of all, I just wanted to ask if you have any changes in your daily routine since last year. Any drastic changes, like maybe going to the gym? You used to never work out, but you started last year. Okay. And let's see what else. Any dietary changes? Not much. Okay. Any lifestyle changes, moves, any stresses, any deaths recently? No. Okay, perfect. And right. That was all the information I needed out of you today. Oh, one more thing. Also, could I get your phone number just so that, yeah, it's just so I can text you all the records if there's anything else. Okay, perfect. Okay, thank you. Okay, so, just so you know, we're going to need to take some tests just to make sure everything is okay. Is that okay with you? Okay, so we're just gonna need a blood sample, and then we're going to need to just do a swab from your mouth. Is that okay with you? Okay, perfect. And you can go into that room and we'll be right with you. Okay, perfect. Hi. Okay, I just got your records here, and it looks like we're going to be needing to do a blood sample today and then do a swab of your mouth just to do a test for that. So, does that sound familiar? Okay, perfect. Okay, so first let's do the blood test. Okay, first of all, I'm just going to need to sanitize first.